While the patient was having a heart attack, surgeon Dr. Harrison had a heart attack on the operating table. The team panicked, the patient was dying, and no one knew what to do. At that moment, ambulance driver Maria walked in from the corridor and calmly said, "Step aside." Hands were trembling, pulse was dropping, and Maria knew she didn't have much time, because those hands had performed surgery under much more difficult conditions before. The ambulance driver who had been working the same route for 3 years had suddenly become someone entirely different. Maria had a past that no one knew about until today. And today, that past would save a life at St. Mary Hospital. Welcome to Hidden Legends. Tell us in the comments which city you're watching from, because when you learn this woman's true identity, you'll understand why she always worked the same route for 3 years and why she chose this hospital. If you believe stories like this need to be told, subscribe and turn on notifications. Maria Santos, 37 years old. She had been working as an ambulance driver at St. Mary Hospital for 3 years, 4 months, and 15 days. Every morning at 7 o'clock, she'd come to her shift, respond to emergency calls, and safely bring patients to the hospital. An ordinary ambulance driver. But Maria wasn't there by chance. That route was where the city's most intensive trauma cases came, a perfect center for life-saving operations. Because Maria Santos wasn't just an ambulance driver, she had served 12 years as a combat medic in Navy SEAL Team 7. That Thursday morning was like any other. Maria had started work at 7 a.m., routine calls, familiar roads, normal ambulance duties. At 2:30 p.m., an emergency call came. 52-year-old male patient, heart attack, being brought to St. Mary Emergency. Maria delivered the patient to the emergency room and was returning to her ambulance as usual. But the panic sounds coming from the hospital stopped her, because Dr. Harrison, the hospital's most experienced cardiac surgeon, had suffered a heart attack while the patient was on the operating table. Maria being at this hospital was the beginning of incredible events for them. The nurses coming out of the operating room were in panic. Dr. Harrison on the floor, having had a heart attack, patient on the table, heart open. "There are 2 patients now. Dr. Harrison also had a heart attack. Dr. Martinez will come in 2 hours. Neither can wait," shouted the head nurse. The team was looking at each other helplessly. 2 heart patients, no surgeon available. Maria heard the sounds from the corridor and assessed the situation. 2 heart attack patients, 1 on the operating table with an open heart, 1 on the floor, team in panic. Maria didn't hesitate. She walked toward the operating room, because she was no longer ambulance driver Maria. She was Petty Officer Maria Santos, and she had to decide which one to choose first to save 2 lives. Maria Santos had joined the Navy in 2003, 21 years old, medical school graduate with limited options. She had chosen the Navy to receive military medical training and continue her career in military service. Navy SEAL Combat Medic Selection was the world's toughest medical training. Maria had successfully passed this process, which only 12 out of 500 applicants completed. SEAL Team 7, the Navy's most secret, most elite combat medic unit, a team only mentioned in legends. Her first assignment was in Kandahar, Afghanistan in 2005, treating wounded SEALs in Taliban operations. Maria's specialty was battlefield surgery, operating in war zones, maximum life-saving with minimum equipment. Operating under war conditions was very different. While bullets were flying, bomb sounds coming during power outages. Her second assignment was in Fallujah, Iraq in 2007. Medical support was very critical in urban warfare, treating soldiers wounded at any moment with limited resources. But Maria's real skill was cardiac surgery, heart operations, chest trauma, internal bleeding. SEALs were wounded in the most dangerous operations. Maria had to keep them alive. Her third assignment was Black Operations medical support on the Syrian border. Special Operations combat medic, working with elite units, treating complex injuries. Maria had performed 156 successful field surgeries over 12 years. She had never lost a patient in any of them. Maria had retired in 2015. 12 years of wars, countless operations, severe PTSD. Adjusting to civilian life was very difficult. She was constantly looking for threats, afraid of every sound, therapy, medication, veteran support. But none of it was enough. One day when she visited a patient in the hospital, everything changed. She saw doctors working, saving lives. She was thinking about the soldiers she couldn't save in Afghanistan, but here were lives she could save. When she applied for ambulance driving, Maria's military background had been checked. Perfect record, reliable background. But no one knew the SEAL Team 7 details. She had been working the same route for 3 years. Every day she witnessed life-saving operations. People thought she was just an ambulance driver, but she was actually a lifesaver on standby. And today, those lifesaver skills would save lives. When Maria entered the operating room, the team was surprised. "Maria, why are you here?" asked the head nurse. "There are 2 patients. What's their condition?" Maria replied. "Dr. Harrison had a heart attack but is stable. The surgery patient is critical. Dr. Martinez is on his way but will arrive in 2 hours." Maria looked at both patients. Dr. Harrison on the floor, stabilized but needing monitoring. On the table, open heart surgery patient, critical condition. "I can save both of them," Maria said calmly. The nurses froze. "You're an ambulance driver, Maria. These are cardiac emergencies." Maria went to the hand-washing sink. "I'm not just an ambulance driver." The team was looking at her. Maria spoke while putting on surgical gloves. "Navy SEAL Team 7, combat medic, 12 years field surgery experience, multiple casualty operations." Silence. Then the head nurse said, "If you believe you can save both of them, do it." Maria first approached Dr. Harrison on the floor. Heart attack but conscious, chest pain and breathing difficulty. Maria made a rapid assessment. ST elevation myocardial infarction. Immediate intervention required. Give Dr. Harrison aspirin 325 milligrams, sublingual nitroglycerin, and metoprolol. Continuous EKG monitoring, she commanded. The nurses recognized Maria's medical authority. This was a professional command voice. Maria established fourth access, 18-gauge needle to the antecubital vein. She administered cardiac medications, morphine for pain, heparin for anticoagulation. She started oxygen therapy. Nasal cannula, 4 liters per minute. "What's your pain scale, doctor?" she asked Dr. Harrison. "Went down from 7/10 to 3/10, much better," Dr. Harrison replied. Maria ordered blood work for cardiac enzymes, troponin, CKMB, BNP. ST segment elevation on the EKG began to decrease. Medications working. "Keep him under monitoring, vital signs every 10 minutes. Now I'm moving to the other patient." She transferred Dr. Harrison to a stretcher, stable condition, pain controlled. After Dr. Harrison was stabilized, Maria returned to the critical patient on the operating table. The patient was in critical condition, irregular heart rhythm, blood pressure dropping. 12 years of SEAL training kicked in. Multiple casualty situations, triage priority, life-saving decisions. "Check the heart monitor. What's the current BP and cardiac output?" she commanded. Maria made a rapid cardiac assessment, coronary artery blockage, immediate bypass required. Triple vessel disease, will do saphenous vein graft, start heparinization. Her hands moved with the precision she had learned in war zones, the decisions she had made among multiple casualties in Afghanistan under bomb sounds. This operating room was paradise compared to those field conditions. Maria started the vessel harvesting procedure, perfect technique, minimal tissue damage. The nurses were amazed at Maria's skill level. This wasn't resident level, this was attending level surgery. During the operation, she also monitored Dr. Harrison. "Doctor, how's the chest pain?" "Much better, vital stable," Dr. Harrison replied from the stretcher. "Graft preparation, anastomosis, blood flow restoration. Every step textbook perfect. Multitasking capability, simultaneous care of 2 patients, a skill learned on the battlefield." 65 minutes later, bypass surgery complete. Patient stable, heart rhythm normal. Maria removed her surgical gloves. Both patients can be transferred to ICU. When Dr. Martinez arrived at the hospital, both patients were in the ICU. Maria was giving the report. Dr. Harrison stabilized from cardiac event. Patient 1, successful coronary artery bypass graft, both stable. Dr. Martinez looked at the surgery notes. "Who treated both patients?" The head nurse pointed to Maria. Our ambulance driver, Dr. Martinez, froze. An ambulance driver handled 2 cardiac cases? Maria explained the situation. Navy SEAL combat medic background, multiple casualty experience. Dr. Martinez reviewed both patients' treatment. This is exceptional medical care, attending level performance. Hospital administrator Dr. Clark called an emergency meeting. Maria, this is extraordinary performance. You saved 2 lives. But what's your medical license status? Maria explained, military medical training. No civilian certification. Dr. Clark made the decision. We'll start the medical license process. The hospital should benefit from your expertise. That evening, local news broadcast Maria's story. Hidden hero. Ambulance driver turns out to be Navy SEAL, saves 2 lives at hospital. But Maria gave no interviews, didn't appear on cameras. The next day she came to work as usual. Same ambulance, same route. Hospital staff looked at her with different eyes. Nurse Janet asked Maria if she was really a SEAL. Maria gave a simple answer. Yes, but now I'm an ambulance driver. Dr. Martinez asked Maria why she didn't tell them. Maria, it wasn't necessary, unless there was an emergency. Hospital staff began approaching Maria differently. More respect, deeper trust. One patient said they had been coming with her ambulance for 3 years, not knowing they were entrusting themselves to a hero. After Dr. Harrison recovered, he visited Maria privately. Maria, you saved my life, and my patients too. I don't know how to thank you. Maria's answer was simple. I just did my job, doctor. You would have done the same. 6 months later, Maria obtained a civilian medical license. Military experience was converted to civil credentials. She was offered a position in the emergency surgery department at St. Mary Hospital. Maria accepted the dual role, ambulance driver plus emergency surgeon, 2 identities, same mission, saving lives. Dr. Martinez asked Maria if she regretted leaving the military. Maria always gave him the same answer. Military service never ends. It just continues in different ways. She specialized in pediatric emergency surgery, saving children's lives. Techniques learned from combat medicine were integrated into civilian surgery. Dr. Harrison also became Maria's mentor. Together, they developed cardiac surgery protocols. Maria's story spread throughout the national medical community. Military to civilian healthcare transition success story. Other veterans were inspired. They saw career opportunities in the medical field. Maria started a mentorship program, transition support from combat medics to civilian doctors. St. Mary Hospital received recognition as a veteran-friendly hospital. Military medical expertise was making valuable contributions to civilian healthcare. Maria's approach. Your military service doesn't end with discharge. It evolves. Your skills, your dedication, your life-saving mindset, these transfer. Those hands that saved lives in combat zones now save lives in civilian hospitals. Maria still works at St. Mary Hospital today, still on the same ambulance route, but now in dual capacity. Sometimes people ask her about her career change, whether she regrets it. Maria always gives them the same answer. Service never stops. It just changes uniforms. Maria watches the city streets through the ambulance mirror. Every day when she comes here, she knows she can make a life-saving difference in emergencies. This is enough for her. Being a SEAL isn't just about combat. It's about healing, protecting, serving. And here, every day, she was saving civilian lives. She touched the old SEAL Team 7 badge in her pocket. She still thinks about the soldiers she couldn't save in Afghanistan. But she's grateful for the patients she can save here. Because real healers go the same route every day, do the same job, and no one notices them, until the cardiac surgeon has a heart attack on the operating table. Maria's story reminds us, lifesavers don't always wear scrubs. Sometimes they wear ambulance driver uniforms and respond to emergency calls. And we never know how many hidden healers are around us. Real healers don't seek fame, don't want recognition, or expect gratitude. They accept dangerous missions, maintain perfect skills, make impossible saves. Maria Santos never tried to become famous. She never wanted media attention. She simply went to work every day, responded to emergency calls, and incrementally saved lives. That's ultimate healing, invisible service, unknown sacrifice, unrealized impact. Maria occasionally walks hospital corridors. She looks like a normal ambulance driver, but inside, she knows. She prevented deaths, she saved families from loss, and that knowledge is enough. Healers don't need applause, they need patient recovery. So have you ever encountered someone like Maria? Someone who looks ordinary but has an extraordinary medical background? Share your experiences in the comments. Help us recognize the hidden healers around us. Because here at Hidden Legends, we know the greatest healers are often the most humble ones. Sometimes they wear military uniforms, sometimes civilian clothes, but always, in emergencies, they're there. If this story touched you, like it, share it, subscribe. Help these powerful stories continue. We'll see you in the next video. Until then, remember, your ambulance driver might just be transporting patients, or might be someone trained to perform surgery under enemy fire. That medical professional treating you could be civilian trained, could be a combat veteran. You'll never know. And that's exactly the beauty of hidden service.